Being a patient advocate is probably one of the most important things you can do as a physician. And let me explain. When I say being an advocate for your patient, I'm talking about not only providing a voice for them, but it's also about putting yourself in the role of the patient. You know, so often it's easy to get sidetracked and be pulled away from that part of medicine that attracted us to it in the first place. That's that altruistic calling. For years, I've always tried to imagine myself being in the treatment chair, or imagining that I was working on one of my loved ones. You know, you can't lose sight of that. The more you adhere to that calling and being an advocate for your patients, I suspect the less frustration you'll have. And let's face it, we are living in some strange times. Practicing medicine now is wrought with all sorts of obstacles, administrative hassles. You know, our time is really, really limited, and it's so easy to get pulled off track. So going back to those basics and remembering how important it is to really be there for your patients. They entrust their lives to you. Their lives are in the palm of our hand, literally. And so not only do we owe it to them, but we owe it to ourselves. You know, some days are much harder, and it's so easy to forget that. However, you've got to challenge yourself. You've got to kind of suck it up, especially those really difficult moments where you're tired, you just don't want to have to deal with anything else for the day, and yet you've got to go in and see a patient. They've been looking forward to seeing you for whatever reason that is. And you can't forget that. You owe it to them to be the best you can possibly be at that time. That's part of being an advocate for your patient. And really, you're really being honest to yourself when you do that. Trying to just pretend that you are, less interested, or that you have better things to do, it's surely a way to be taken off that path. And that path is one that leads to nothing but frustration and even things such as burnout. So really remember, being a voice for your patients really makes the difference between being an excellent physician or just somebody who's good. We've all got gifts. We were all blessed with intellectual abilities and curiosity, and whatever part of medicine that's taken you to doesn't really matter. The point is that, again, we have to use those gifts, and part of those gifts is being a voice for our patients always, and never forgetting that. So until next time, remember, we see you, we believe in you, and we're here for you.